Okay, great. Well, yeah, so I just wanted to say, thank you for giving me the opportunity to present today. I'm really excited to, share with the community and continue to get the word out about, the services and supports that we offer here in Health and Human Services. Okay. So I guess just to start off, so I started in this position as a community social worker just about a year ago. So I started November 2019. I'm joined with another town social worker, Donica Castle, who works on the Council on Aging. And basically how it works is residents who are under 60 are my responsibility, and Donica serves residents who are over 60. So together we cover the whole town of Bedford. So a few years ago, the different departments kind of merged together under the umbrella of Health and Human Services with Heidi Porter as the director. And that includes the Board of Health, the Council on Aging, Veteran Services, and Youth and Family Services. And then within Youth and Family Services, so there's myself, and then we have Carla Olson, who is a Healthy Bedford coordinator. She's also the person responsible for running the Bedford Food Bank at this time. So yeah, so I'm going to let you know about some of the direct services that we offer. So the first one that I wanted to talk about is the Bedford Food Bank. So the Bedford Food Bank came into being right around the end of March, beginning of April. It was really recognizing that, due to COVID-19 and the pandemic, there was a large need and food insecurity that was quickly developing in the town of Bedford. So in the past, this was being served by the Bedford Food Pantry, but unfortunately, due to town center closing, they were unable to continue operations. So that's when Youth and Family, we had to step in and establish the Bedford Food Bank. So we've been running that every week. So right now it's Thursdays from 4 to 5:30. It's located right in the rear of town center. The great thing is all someone has to do is you just drive up your car, pull right up, and then a volunteer will load your car. So we really do like a contactless system, and then there's no need to pre-register beforehand. And then in addition to the drive-up service, we also do offer home deliveries for residents who are in need of that. So for example, like some different residents that we deliver to, if they're homebound, if they're seniors, if they lack transportation, or if they have a work schedule where they're unable to make the Thursday night, drive-up service, we do offer that delivery service. So we really are trying to help as many families as we can. So typically we serve about 60 to 70 households a week with the drive-up service, and then we have an additional 40 households that we serve through the home delivery. The food is provided to us by the Greater Boston Food Bank, and then also funded by the Town Emergency Fund for any additional purchases. All right, and then along with the food bank, we also have the Diaper and Personal Item Bank. So this program was established in July, and it really was kind of recognizing the fact that there are certain items that families need that are not covered by SNAP benefits, and really we're putting a financial burden on people by not being able to obtain those items. So for example, diapers, baby wipes, and menstruation products were the three items that we decided to focus on with the Personal Item Bank. So we started collecting those items initially by using the Town Emergency Fund. But then, an amazing thing happened where residents have been donating diapers, baby wipes, and products, and we've really been able to keep it well stocked and going. So typically how it works is either a family can access those items through the drive-up food bank. We kind of have an area where they can tell a volunteer if they need any of those items, and they can get them right at the drive-up. Or if they contact Bedford Youth and Families, we can deliver those items, and we typically give them up to like a 3 or 4 week supply of those items to make sure that they're sufficiently stocked. And then to date, we've given away over 200 boxes of baby wipes, diapers, and menstruation products. And we've only had this program going since July. So it's really been a significant relief to families who've been struggling and really need to free up some of their finances to focus on things like rent and purchasing food. All right. So here at Bedford Youth and Families, we provide mental health services. So some direct services that we provide right to the community. So the first one, so we contracted starting this July, was the interface program to Williams James College. So basically what the interface program is, it's a help referral line. So basically a Bedford resident can call up and do an intake, and then they're connected to, then the interface service will connect them to a mental health provider to set them up with ongoing counseling. This is really to kind of recognize the need that it's tough to find a mental health provider. People, you know, it can take months to get connected to someone. Everyone isn't always helpful in terms of being able to identify a provider. So we really wanted to contract with the service to be able to quickly help someone, you know, identify their needs and then connect to the appropriate services. And, you know, the important thing too about interface is they really do take into consideration not only, you know, basic billing information such as, you know, insurance, but also like, you know, what the specialty is, if there's a gender preference for the provider, and location.
Chris, can I just stop you for 1 second, just because somebody is not on mute and speaking and it's clouding up your presentation.
Nancy,
everybody mute. Yes.
Yeah,
thank
Nancy,
you.
I just muted that person.
Thanks.
Okay.
Go ahead, Chris. Thanks.
Sure. Yeah, so again with interface, so it's really simple. You just call the helpline number. They're open Monday through Friday from 9 to 5. You do an intake, and then they try to connect you to a mental health provider within 2 weeks. And not only is this open to all Bedford residents, but this is also open to all students of the Bedford Public Schools. So those METCO students are also eligible to access the service, which we thought was important. And then I guess I just wanted to, just because I found this out yesterday, just, you know, as I'm telling you about this service, they are going to be closed from December 23rd to January 4th, as this program is run by psychology students, and they're going to be away for winter break. All right, so the other mental health service that Youth and Families offers the town is, so we have a contract with Elliott Human Community Services to offer mental health counseling. So before, you know, the whole COVID-19 pandemic, that was being offered right here at Town Center. So residents can come to Town Center and obtain counseling here. Unfortunately, at this time, since Town Center is closed, they've moved to they've moved to a telehealth model. But we're hoping, you know, once we get past this, those services will definitely resume. So the important thing about, you know, the service with Elliott is Bedford residents don't have to pay a copay. So that's big for some individuals. And then more importantly, insurance is not a barrier to beginning therapy. So if someone like calls Youth and Family looking for a referral and they say, I don't have health insurance, that's not going to be a barrier for them to start mental health therapy. You know, that might be a situation where in the meantime, I might help them connect to like Mass Health or another health insurance. But, you know, we do have funds set aside specifically to help residents who do not have health insurance get connected to mental health therapy, because we recognize that's an important, you know, essential service for individuals. And then to make a referral, you would either call Youth and Family Services or Elliott directly. So either one of those resources to get connected to mental health counseling. And then, you know, our mental health counselors, they serve a wide range of age. They serve children, adolescents, adults, elders, and they have a wide range of specialties. All right, and then next, and then social work services. So this is my role. So initially, so my role is kind of envisioned as like a bridge to services and resources. I can be the point person. And you know, that initial kind of phone call or that initial contact, and then it's my job to kind of assess the situation, find out what the person's kind of needs are, and then connect them to the most appropriate resources. So I deal with a wide variety of issues and resources, including mental health, substance addiction, domestic violence, food insecurity, housing issues, homelessness, low-income barriers, health insurance, and basically whatever else a person is calling to, you know, that they're struggling with or need help. The important thing is, like, I'm not always the person who's going to have the answer, but it's my job to find you the right resource and you know, make sure that you can get the help that you need. yeah, so it's kind of recognizing that every person is different. There's some residents where it will just be one phone call with me. I'll give them the resource they need, and then they'll kind of go about their day. And then there's some residents where I'm checking in with them, I'm meeting with them on a weekly basis. So it really depends on like what their individual need is, and then finding them that appropriate resource and intervention. The other thing too about my role is I'm community based. So residents don't have to just come to town center to see me. I do home visits. I can meet them in the community. During this time of the pandemic, I've talked to a lot of people like over Zoom, over the phone, and through email. We're trying to be very adaptable to kind of meet a resident's needs and kind of identify what their barriers are and make sure those barriers don't get in the way to them receiving the intervention. And then, and then another important kind of practice is working to do, collaboration with the other town departments. So I work very closely with, with Bedford Fire, Police, the Council on Aging, DVSN, and the Bedford Public School Systems. We get referrals from all sorts of resources. It doesn't always come directly from the resident, and that's really to try to maximize, the service and promote that collaboration. Okay, so and then I just want to let you know about some upcoming services that we have and some things that we've recently done, just to give an example of some other direct services that we provided. So coming up January, we have a Bedford Virtual Career Coaching Boot Camp. So that's going to be from Tuesdays from 7 p.m. to 8:30. And basically the goal of that workshop is to, it's to learn resources and best practices to be able to find a job, or if you're contemplating a new career. And the important thing about this is we really wanted to put an emphasis on this group that, that this is open to all ages. So, everyone from, so like a high school student looking to get to their new job, to someone who's currently struggling finding employment, to maybe a senior who's looking, for part-time work. This is open to all ages, and we're excited to be able to offer this to Bedford residents. So if anyone's interested, or if you know anyone's interested, please just reach out to me, and we'll get you registered. And this workshop is completely over Zoom at this time, and we're looking to start it in January. The other thing that we're excited about is the Council on Aging and Youth and Family Services are becoming SNAP partners with the Department of Transitional Assistance. So basically what that means is we'll get access to the DTA portal and be able to more effectively sign residents up for SNAP, or the Supplemental Nutritional Assistance Program, or otherwise known as food stamps. So we're really excited to be able to get access to those tools and be able to more kind of directly help residents in that way. We just wrapped up a transportation grant through China 15. So basically this was a program where we helped residents with issues of transportation get to their doctor's appointments, get to their mental health appointments, and participate in activities that would support their mental health needs. So this could be something as making sure that they have the ability to go to the grocery store and get the supplies they need, to attending psychiatric appointments and doctor's appointments. So it's another way that we're recognizing, we're always trying to continually assess the community and see what are the needs and what are the most effective interventions to kind of meet those needs. And transportation really is a barrier that frequently comes up with our residents who may be struggling. The last few services that I want to talk about is we're offering kind of winter specific services. So through the food bank, we just had a turkey meal pickup. So we were able to, through Market Basket, we're able to get frozen turkeys. We got pies, apple cider, and we're able to serve about 80 households with those items. So we were really excited for Thanksgiving to provide those meals, to the residents in need. Upcoming, we're working again this year with Project Ezra. So this is Temple Isaiah in Lexington and Temple Sheikh Tikva in Winchester. Basically, they have volunteers. They cook and deliver Christmas meals. So they deliver a hot holiday meal on December 24th for the residents that we're able to identify and refer to them. Unfortunately, it looks like the demand for that is really high this year, and they just met their cap, but we were able to sign up about 60 Bedford households for that service. So we were excited about that. We also have the winter. We're able to provide winter coats through partnership with Cradles to Crayons. So if you know anyone, that's serving children 0 to 12. If you know any children who are in need of winter coats, we can certainly get those ordered and provided, provided to those kids. We also help with fuel assistance. So Community Teamworks Inc. over in Lowell offers, they run the fuel assistance program. Unfortunately, it's a federal program and it's a really complicated application. So we really take the time, we make an appointment with residents. We make sure that they have all the right paperwork. We sit down with them. We do the application. We make sure it's done right, and then we'll send in the application to make sure that residents who need fuel assistance are able to access those services and get that credit on their fuel bill. And then last but not least, we have a holiday gift card program that we're launching this year. So right now we're currently accepting gift card donations to help families in need purchase holiday gifts for their children. We've really recognized that this year has been especially tough for individuals. There's a lot of people collecting unemployment and stressed out about making their rent, and holiday gifts seems like a luxury for a lot of people. So with this in mind, we've started collecting gift cards with the goal to be able to help some families out so they can purchase holiday gifts. We're collecting gift cards from all sorts of retailers, but I think the main ones were Amazon, Walmart, and Target. So people have the option to either shop online or shop in person, depending on what their needs are and their level of safety concern. So that is that's an overview of some of the services we offer. Again, I'm always discovering new resources, and we're starting new programs. So I just wanted to, I thank you again for giving me the opportunity to come and present today and just get the word out about all these programs. And